Welcome, everyone. Good afternoon. This is the very first of the Harvard Data Science Initiative's industry seminars of this academic year. My name is Liz Langdon-Gray. I'm the Executive Director of the Harvard Data Science Initiative, and it is a true pleasure today to introduce our speaker, Slawek Kierner. Slawek is Senior Vice President for Data Platforms and Machine Learning at Intuitive. Intuitive is the maker of DaVinci surgical robots. Slawek is responsible for digital products, data strategy, and digital platforms across DaVinci surgical robot platforms that power the science of surgical data to improve surgeon education and ultimately patient outcomes. Slawek has degrees in mechatronics and management from Lodz University of Technology and has seen a lot across an expansive career in data and analytics, including time spent at Humana, Microsoft, and Procter & Gamble. We are grateful for his time with us here today. Before I hand over to Slawek, just a few housekeeping notes. There will be time after Slawek's presentation for questions, which will be moderated today by the Harvard Data Science Initiative's Scientific Director, Lawrence Weisbach. If you have a question, and we hope you do, please use the Q&A function to share your question at any point during the presentation. We'll then read those aloud to Slawek during the Q&A portion of the session. Please don't be shy. All questions are good questions, and we hope we have many of them. With that, let me again thank Slawek for being here today and hand over to him to present. Slawek, thank you.
Thank you, Lisa. Thank you for such a great introduction, and it's an immense honor for me to be here in front of all of you as part of this Harvard Data Science Initiative seminar. As a kind of little background about me, I think Liz introduced it pretty well, but I think this experience is frankly connected the dots of more than 25 years of my career in data and analytics, and all of this experience is starting from the work in Europe with Procter & Gamble, where we managed some of the biggest consumer databases in the region, have taught me a lot about privacy and how one needs to approach the trust of consumers. And then the more recent career at Microsoft with the launch of Power BI product, but then moved into a full portfolio of products that are based on data and AI techniques, have been a big cornerstone of what I brought with me to healthcare, where I believe we have a lot of potential to improve patient outcomes. So my plan today is to share with you how we approach the use of data and AI with surgeons and with their teams, and how this opens a totally new space of surgical data science. With Harvard and major hospitals in the area, I frankly believe that there is a lot of potential for closer collaboration between industry, the data scientists around Harvard, as well as surgeons in our hospitals here, to advance this surgical data science. And maybe the talk today will convince you to consider this new space for your own academic interest. So with this, let's talk about Intuitive and our approach to data. You probably know our company not that much by our name Intuitive, but more by the products, and specifically the DaVinci surgical platform. We have more than 4 generations of this product already in the market. And actually, frankly, also 2 other platforms, the single port and Ion, which was more recently launched to help with the cure of a new set of diseases around lung, specifically the lung cancer. What surrounds all of this ecosystem of robots in the hospitals is obviously the digital platform and a set of digital kind of tools and technologies that leverage data created by the robots to provide better experiences for our customers. So when you think about the robot itself, it is currently one of the more sophisticated, if not the most sophisticated pieces of technology that is in the hospital. Our current DaVinci robot has 4 arms and each of these arms creates immense amount of data. Now, some people believe that robots kind of move by themselves. Actually, in our case, there is always a surgeon in the operating room that is sitting behind a console, which we also call a surgeon sidecar. Now, this collaboration between the robot and the surgeon have led to more than 12 million surgeries so far, and this 12 million procedures to date obviously also created an immense data set, a very, very interesting and a new novel data set around surgery. The power of this data is in creating new insights around surgery, but also I believe there's a chance to create a set of differentiated digital products that in the end help improve patient outcomes. All of this is going to be based on a very differentiated data set. So I think one area that is important to think through, and we spend a lot of time on this internally, is how you could imagine creating value on top of this data. One area that is exciting me most, where I'm thinking about the impact, is how can we stitch the data together so that we can provide a unique pathway to every particular patient and particular surgeon. So just think about this. Now, what could be the impact when we move from a more kind of standardized approach to surgery to something that is way more personalized, based on immense amount of data, the predictions that can be done on top of this through our current data science and AI techniques. So as it comes to data, I think you cannot talk about its impact without first taking a deep look into the ethics, because the data provides a lot of power, and as you've seen, if you don't think deeply about the ethics before you start building value on top of data, then things might go wrong. So we also spend a lot of time there, and one of the approaches that we take, or the principles that we have, includes basing on trust and on transparency. And trust comes in many forms. The first two things that come to mind when we think about trust is to make sure that whatever we do provides reliable outcome, and that the data is kept in secure fashion. This is important because the type of data that we deal with is a bit special. Obviously, it's relating to human life, and at the same time, there is this unique relationship between us, who have a power to understand the very sophisticated data created by the robot, as well as by the surgeon who is operating, who is doing the procedure, and then the patient who is being operated upon. So really, going deeply into understanding the trust and understanding the data, creating trust, and also being very transparent in what we do with the data, I think is very, very important for us. So these two principles are key for our operation. Now, once we understand, this part of ethics, obviously, the next thing comes, like, how can we create value, knowing that we have all of this data and we have a power of current analytical techniques. And we think about this in context of these virtuous loops, which start from data and then move through to insight and then to action. And this is important because without closing the loop fully, you kind of don't start on that flywheel of value that is being created. So when it comes to data, we need to make sure that the data is of high quality. We need to make sure that it is interconnected, and this is frankly where we have probably most challenges right now in healthcare, to make sure that we can create this longitudinal health records that stitch the different features around the patient together with the robotic data. Then once that is in place, of course, securing and making sure that this data is accessible at the right moment, at the right point of care is key. Now, once you have data, there is a task to create unique insights on top of data. This insight needs to be relevant to a particular process, but also it needs to be actionable. If we create insight that someone cannot act upon, then there is obviously a hard time to close the loop. Now we'll talk a bit more about the specific areas of where we believe we have created the differentiated insight and how then these insights are leading to closing the loop around through actions that include recommendations of what a surgeon can do to be better in their current procedure or in the next procedure that they will do. Once we have these insights and we want to drive action, it is important to find good ways and means to notify, train, and empower our surgeons who are typically also very busy. So you need to make sure that you find good ways where you can actually have relevant data, create relevant insights, and then have meaningful ways of engaging surgeons in these insights so that they can get better and increase in quality of outcomes. And outcomes clearly is the first area that we look at internally, for me and also the company. Of course, anything that we can do to improve patient care, to make sure the person gets a surgery that is quicker or better or more consistently bringing a person to a healthy state is of course key. So that's our first focus. How can we improve the clinical workflow or decisions during the surgery so the outcome is better for a patient? But then there's also a very, very important one, a very important loop that is around surgeon learning. So as for all of us, we are of course moving through their careers, and so do surgeons. And some surgeons retire, and new residents need to learn, train the techniques of surgery, and then become surgeons as well. So a lot of focus and a lot of value can also be created in better, faster, more efficient training of new surgeons, new residents, and fellows. So there are also loops that we are working on and providing that are around personalized learning. And then finally, an important topic as well is the topic of efficiency and optimizing the surgical programs. So surgery is a relatively expensive task and involves a lot of capital equipment and also a team of surgeons and nurses. And we all know that there is scarcity there, and also healthcare costs are an issue for all of us. So thinking about how can we create loops where surgery is more efficient, quicker, faster turnaround, so that on the same day, the same team, the same hospital can provide more services or more surgeries to people. I think is also an important loop that we are working on with this data and the tools that my team is building on top of the data here. Let's kind of look for a little bit more specifics and dig a little bit deeper into what is our approach to using this data and how this creates a new field of the surgical data science. So to start off, it is important to understand that surgery is a very complex task. There are so many different surgeries, and every surgery has an immense amount of variables that can differ. Variables that are related to the context of a patient, how sick or healthy the person is that is undergoing surgery, and then there are so many things that happen during surgery, during this typically couple of hours of a surgical procedure. So to effectively deliver on this particular task, it's important to decompose a problem into different phases. For us, we start from capturing data. So we capture data during surgery. Sometimes we call it kinematic data. This kinematic data needs to be attributed to specific task or phase of surgery, the activity that is going on. So we split the whole timeline of surgery, the few hours of surgery that is varied into specific phases of tasks, and then we calculate calculate KPIs, or we actually call it internally OPIs, objective performance indicators, for each specific surgical activity. This decomposition allows us to quantify surgery and then compare surgeons and procedures, and then start to reason around correlations between those KPIs and health outcomes or efficiency in context of this efficiency loop. So more specifically, when you think about this objective performance indicators and how they may play a role, you see a surgery here of an inexperienced surgeon that took 1 hour 45 minutes for this particular procedure, and then an experienced one has been taking less, and you see though that they have been performing similar tasks. The surgeries themselves, during surgery, the tasks are relatively standardized between patients or between surgeons that kind of train on the technique. Although also here, as already introduced before, there is quite a bit of variability. So you might have different schools of surgery where similar procedure would be approached with different sequence of tasks. So like you see here, we are taking this hour and a half or so of surgery, and we are splitting it into tasks. And in each of these tasks, we try to follow the kinematics, the things that are happening in the body, and then calculate objective performance indicators. Now, the big question that we've been answering over the last few years is, can these objective performance indicators predict clinical outcomes? So is there a relation between these indicators that we can calculate and then the outcome of surgery? And the preliminary results of this are compelling, and they have been also published over the last few years that essentially confirm that yes, there are clear kind of relations between the two. Now, the question is, so we come back to the context of this talk, introduced a bit earlier. So there is data and then there is insight, right? So we created data about the surgical steps and then the objective performance indicators during the steps, and we also can create some kind of insights, understanding that they are actually relevant for outcomes. Now the question is, what can you do with this? So with every system that we sell, and also with our current platform, we provide also an opportunity for our customers to have a simulator. So similarly to how we have flight simulators for pilots, we also have surgical simulators for surgeons that provide an ability to go through exercises. So here you have actually a video of such a game, simulator game, an exercise that a surgeon can perform. This particular one is around specific gestures of how you suture within the body. So coming back, you can have data, captured during surgery. Then we can identify performance indicators, and we can provide that information back to the surgeon. And then to close that loop, the idea is to ask the surgeon, to notify the surgeon that maybe there are a couple of OPIs that they can improve by going through a set of specific personalized exercises on a simulator. So with all of this, with all of this loop, still I think what is very important for us is to measure impact and see how surgeons that go through this loop improve and elevate their practice and their technique. And I'm really excited about this particular step and how this will help provide better care, better outcomes, and improve the quality of surgery. So this actually is in some ways just a start for us. And what I think is important to realize is that with this ability of capturing data from surgery, we open a new space of data science, surgical data science. But next to this kinematic steps, also, frankly, has a quite extensive data set of videos. So what you see here on the screen is a video of surgeons and how they can we can compare the surgeon that is less experienced with an expert in particular step of surgery, and then also understand the performance indicators on the side. So we have this opportunity to bring even more data and leverage the AI and ML-enabled services to close these loops and to create value and outcomes and efficiency of surgery. As you can see here, there is this evolution of in the past. The surgery has been fairly analog task, so not much data collected. Then today we have quite a bit of data already there. But when I see the future here, all of this science and surgical data science will help us stitch this data even before the surgery, so that during surgery we can provide even more insight and affect outcomes for each procedure. Personalized with care. How do we know which OPIs matter most? And that's like the kind of central question for us, because we can generate and quite a lot of different OPIs, and this is frankly where today the kind of central kind of questions around research questions around our area emerge. And for example, here you have you see a very recent paper that looks into the progress of a learning curve and how a surgeon has been able to do the same procedure quicker and quicker in terms of their time, and time is one of the performance indicators as well. And then we can see how that kind of emerged also in different phases of surgery. Then what we can see is that for each of these OPIs, we can look into variability and compare the variability and the absolute values of these performance indicators between the expert and the novices. And then from this reason, what are the type of behaviors that kind of pull a surgeon from being relatively inexperienced to being experienced in performing certain surgeries or tasks within surgeries. And then again, from these OPIs, we can provide personalized exercises to help surgeons evolve their technique. How to progress here is frankly a fairly complex task, and we understand that we cannot do it alone. So this is where we frequently reach out to the academic community and have a number of these data collaborations that typically pair a surgeon, an innovator surgeon, with a data scientist to work together and publish around this particular technique or domain or a type of surgery. So and then we want to be obviously very transparent and we want to make sure that whatever is being done is sound. So all of this work we strive to publish in peer-reviewed journals, and that has started roughly 7-8 years ago, 2016, the first paper that linked that talked about simulation and objective performance indicators there. And when you look at this table, you see that every row gives an area of surgery. Frankly, within each of areas, like general surgery, you have dozens and dozens of different procedure types. So you can think about this table being very long in terms of opportunity to really research what is relevant and then publish around this. And then in columns you see different areas of scientific inquiry around surgical skill and education, the operative workflow efficiency, outcomes, all the way to even thinking about new data science efforts. And yes, from time to time, it's useful to do a review of what has been published so far. So we started in 2016 with one paper. As I go kind of very quickly through this table, you see more and more papers being published around the space, but there's a lot of white space. There's a lot of white space to publish, and especially when you remember that every row, frankly, it groups dozens and dozens of different procedure types in every cell of this table. You might expect 20, 30, 50 papers that need to be published, science and research and knowledge that needs to be created on what matters for what OPIs matter for surgery. So there's loads of space, probably 1,000 at least, or maybe more papers in front of us in the next 4 to 5 years, but will be written and published by those surgical innovators, so the surgeons that want to innovate, typically coupled with a data scientist that is helping them. Just in closing, the last 2 slides, and I think the impact of this will be significant. It all starts with a unique data set where we need to be driven by trust and transparency to be allowed to work in this field. We can truly transform healthcare journeys, get more personalized care, more predictive care, and moving from the kind of reactive, post-analysis to also proactively understanding what OPIs will matter for the next patient that is going to come under to be operated. This creates this new space of surgical data science. There are new data streams, very interesting ones to study. There are a number of surgeons that look for partnerships with data scientists. So if I know this interests you, let me know, and we can certainly direct you to collaborate with some surgeons either here in Boston or frankly broadly around the world. There are people that are looking at how this is advancing, and your research and your work here can truly drive patient outcomes. So it is worth doing. So with this, let me stop and just thank you all for your attention. Hopefully some of this was interesting, and I will pass to Lawrence to drive our Q&A session.
Thank you very much, Slawek. That was a fantastic presentation. Really enjoyed it. So this is the Q&A period where we answer some questions for Slawek, and we have quite a few, actually. Let me start out with one question myself. One thing that I've seen myself working in hospitals for some time is that there's a trend toward clinical teams customized for patient care, surgeons, nurses, so forth. So there's an operational and organizational aspects to all of this. And I was just curious how the surgical data science can improve the efficiency and actually the makeup of these teams to maximize the care for these patients.
Thank you, Lawrence. It's a very good question, and you are 100% right. So the training is a team sport, and it's enough to just come into an operating room, and then you see how a surgeon interacts with nurses, surgical staff, assistants that are there to make a good surgery. Yeah. So in this, there are a number of things that data can help with. Again, thinking about frankly all of the 3 loops. There is the performance of a team. There is the training topic. How do you train good surgical team? And then there is a very important topic of efficiency, as in between the surgeries, the team helps during surgery and then prepares the next patient for the surgery, and then there's this whole set. So it's an immense opportunity. We started focusing on the surgeon. We frankly have some research efforts internally, but also looks into the operative team, looking into the signals, and for a number of years, we've been actually even providing consultations to hospitals, people that sit, at the corner of a room and kind of know who is doing what, and then come back and then provide recommendations. This data can be captured through sensors these days. So we have actually an effort to also look into this particular space, and again, capturing meaningful data, provide this in meaningful reports, and then hopefully also drive opportunities for people to learn and train, to either looking at videos or getting trained through even XR techniques or otherwise to get better.
Fantastic. Okay, some questions from the audience. Number 1, what kind of governance structures do you use to ensure trust and transparency? Is this just internal? Are there external third-party groups that are publishing guidelines?
Yeah, very, very good question. And I think for for every company, it is a bit of a particular topic of how do you organize for your governance. So there is no clear rule. Obviously, it depends on size, the type of data that you need to deal with. What we have internally at Intuitive already for a number of years, we have our chief privacy officer that is kind of looking and reviewing every single use case that we have. We strive to follow laws wherever we operate, and we operate globally. And these laws, unfortunately, are not always the same. So you need to study it deeply and make sure that you're doing things which are appropriate. But it's important, like maybe just to summarize, it's important to have a governance structure. It's important to have someone that has the second pair of eyes on what the engineers, data scientists, the innovators, the product people out there that want to go and create all the value. Obviously, typically with good intent, but it's important to have a governance structure, someone that reviews, approves, and makes sure that things follow your own principles.
Great point. Will doctors learn first how to do the surgery and then learn how to do the robotic surgery? Is there a sequence there?
It's a good question. What we see is actually, I think 80% or so of residents, so kind of new, upcoming surgeons want to do robotic surgery, and that's because of the extra capabilities, the innovation. Also, typically younger people are of course keen to adopt new technologies that we provide, but also there is very important career-related topic, because surgery done in a previous ways for laparoscopic or open surgery requires a surgeon to lean over the body, and that typically leads to all kinds of complications with your spine and limits the length of your career. So new people want to do robotic surgery. And today, I think the education is parallel. So you need to learn normal surgical techniques, go through your med school, go through understanding how to treat a patient also in other ways. And then robotic surgery is like this additional skill that you acquire, typically already in your academic institution. So it can be a parallel path.
Perfect. Okay, let's see. A few other questions. If one wants to pursue a career in this field, I think you kind of just touched upon it right there. Would it be more beneficial to take the academic or industry route? I think that's what the person is asking about.
You think about this for a second. It's with all what happens to us with AI recently. It's kind of hard to tell for the next 40 years of what is better for someone. I think it's an interesting field. Honestly, if you have passion for science and publishing and teaching others, probably you'll do super well in academic field. If your passion is more on creating value, creating businesses around this whole kind of operation, dealing with customers, creating scale around the product that is kind of launched in the market, you'd do better in the industry. And the data science and data is probably a common thing. You need to like data and like data science.
Definitely. Here's an interesting one. Goes to your OPIs, your performance indicators. Do you have examples of studies where OPI improvement is linked causally to robotic integration? Or asked differently, how do you know OPI improvement is linked to robotic integration?
So first of all, very, very good questions, because correlation is not causation, and to really kind of prove to yourself that you are closing the loop and leading to an outcome, you need to get into causation. I would say that there are a couple of studies out there, and some I was kind of referring to some of them in the footnotes which kind of already link OPIs to outcomes. So there is this kind of correlation. We have studies that show that the learning loop is closing. So if you provide OPIs to a learner, to let's say a resident that learns a technique, those residents are learning faster after seeing the OPIs. Kind of understanding the OPIs drives faster learning. And as we speak, we are setting up a number of studies with our data collaborators to do even more of this causation. And that's why there is this new field. There's so much to study. So we have some, and and like you've seen, there's acceleration of papers published, and some of them are about causation. But I would probably be frank saying that we started with correlations, and we are very confident that that exists. And then there's a lot of causation work that is in front of us that I think will unfold over the next 2 to 3 years. So.
Yes, I think correlation and causation are such a key aspect of data science these days. So I'm sure there's going to be much more to come, much more developments in that area as we go along. So thank you for that. Next question, do you see the developing AI field having any effects on this area?
Huge. I mean, obviously, we already benefit from quite a bit of AI as we leverage more traditional techniques. And gosh, I probably wouldn't say 3-5 years ago that deep learning is a traditional technique, but now it kind of becomes more traditional, I would say, than the large language models and all what we have seen over the last year. And we already, to an earlier point, we already leverage deep learning, for example, to automatically split the video into phases and tasks and calculate some of the objective performance indicators. Our tools that we provide surgeons also casually kind of create a number of tree models in the background to highlight the different correlations that would be interesting to study. So we actually have some of this machine learning model creation automated within the product. There's quite a bit of use of vision-based kind of deep learning to create maps of lungs for our ion lung endoluminal system. So we have quite a bit of AI already that is leveraged in the firm. And obviously we are also on top of the large language models, story and topic, and see how this can further optimize both internal processes on how do we develop new medical devices where there's loads of documentation, for example, that needs to be studied, created. There's loads of code. Our company, all of these robots have a lot of software that runs them. So this acceleration of writing code is exciting for us from like an internal efficiency as well. But then the natural interfaces for surgeons to be able to study the context of the patient, and also the training of our teams can be accelerated. We're looking at these use cases as well. So the overall answer is yes. There's a lot that AI can provide.
Fantastic. Let's see, next question. Just go to the top here. Quite a few coming in. I'm not sure I understand this question, but maybe you do. It seems to me that the data gathered has huge implications for outcomes during rare procedures or other issues of selection bias with regard to outcomes. Are you finding that to be the case? I'm not sure what the person's getting at, but maybe you do.
I think about it. I think there are two questions here. There's a question of rare procedures, which indeed is I think important, and when it comes to rare procedures, having a system that is used across the globe, where these procedures are recorded and data is recorded, is helping provide more accessibility to understanding of how this kind of rare procedure can be done. So I think that we are making quite a bit of impact here to be able to more effectively treat a rare situation, a rare shape of a body, a rare thing happening with a patient. So yes, we have an influence here. Now, is there a selection bias when it comes to procedures or outcomes? I would say the context is always important. The context of a patient is important. So that's what we are kind of striving to now bring more so to this analysis, to really understand and work out for different comorbidities, different shapes of body, the body mass index. Now, all of these things can have impact, and is a concern for our studies. Now, the other side of it is there selection bias because there are more simple procedures done on the robot than in kind of open or laparoscopic ways? I wouldn't say so. I'd say that what I have heard from surgeons is quite often they actually think about the robot as something that is enabling them to do even more complex procedures. So So as we think about this kind of comparisons and progress of the field, we are getting a fair share of complex patients in robotic procedures as well.
Okay. Next question is very important. It comes to the point of costs and the financial aspects, which obviously are a key driver of healthcare and a key, very controversial sometimes. So the question is, will the increased use of surgical robots change the cost of surgeries in the future?
It's a very good question, and obviously a concern for all of us. And see, the way we look at this is really looking at the end-to-end cost. So there is a cost of the procedure itself, but obviously is typically done a bit less expensively without a sophisticated tool. If you just use a knife and essentially a scalpel, then it's probably going to be a bit less expensive. But the question is how long a person will need to stay in a hospital. And what we see is that with robotic approach, even very, very complex procedure that used to take 10 to 12 days of staying in a hospital, we can do them on the same day, and the person comes in and gets out of a hospital the same day. Then typically returns to activity, also much faster, whatever this activity could be. And when it comes to someone being employed and working, that also decreases this cost. We also see less complication, less blood loss, less pain, less medication use. So when you look at this kind of end-to-end basis, we typically see, and we have actually our studies that we do on customers' data together with the hospital, that this end-to-end cost in the procedure is lower than a procedure done in an open way.
Yes, very important points. Thank you. What challenges do you see with utilizing surgical data and insights in hospitals' clinical settings? Can we expect hospital data teams using this anytime soon?
I would hope so. We actually are promoting and hoping that this data and the tools that we provide with the data to really understand, the very complex data stream created by the robot is used by the surgical data teams. So we have interest to open it up, and we are actively working to get hospital teams to use it and to collaborate with us, because for all of these tools, what we need is we need robotic data to be stitched together with hospitals' EMR data, to have in one data set, if you think about this, both the context of the patient when we talked about the selection bias potentially, and then also the outcomes, so that we understand the outcomes in context of both, the cost that we talked about, but more importantly also the outcomes and then all of the robotic APIs. So this collaboration with the hospital data teams is very important. We're making slow progress. I truly hope this progress will accelerate over the next few years.
Yes, definitely. I currently work in FCMG health industry with a background in biochemistry. I am looking to go more into the IT machine learning space throughout my career. Do you have any advice on resources to assist with this journey?
Question. I think we are blessed with having many resources, including excellent courses in our academic institutions, including a lot that is there in online learning communities. I would say that fluency in data will be important, so I would stay there. I think that the current phase is such that the data science becomes easier, especially what we have seen as advances in these large language models. We clearly will need some data scientists, or probably a lot of them, but we also will need a lot of data engineers and people that care for data quality, for stitching data together, for maintaining the trust, transparency, security of data. So if you are looking at the career change, I would probably focus on this space.
Great. Are there any types of surgeries that robots would not be able to perform? And do you see a future where robotic surgeries are more common than humans performing surgery?
Well, thank you for the question. And this question comes often. I was actually surprised it didn't come yet. People think that we'll have robots and AI operating on us without a surgeon, and I don't think it's coming too soon. There are a number of barriers for this future. which will take us a bit, but the journey is certainly going in that direction. So, and the barriers, if I start with are including legislation, the approvals that you need to have to operate. So that typically slows things down. There are also just typical trust, related challenges that we also have when we are flying. Probably we can, most planes can fly without a pilot. We still prefer to have a pilot with us in the airplane. So for all of these reasons, and then maybe the final one being, it's very complex field. Surgery, like we talked, there's loads of various variables, but it also means that techniques are fairly complex, and there are no lanes and no traffic lights within the body. So we have quite some challenges to solve, but we'll inch on this, inch by inch, and kind of trying to automate certain pieces of the procedure, or making all the time that work of a surgeon easier, more predictable, with less variability, to get to better outcomes. So that's the future that clearly is in front of us in the next few years.
Yes, definitely. Thank you so much for that. I don't see any other questions, so I will have some housekeeping notes, but first I want to thank Slawek for a fantastic, fascinating presentation. It's inspiring. I mean, it really was. So thank you so much. And also for the participants, the people who asked questions, much appreciated. So a few housekeeping items. Our next industry seminar will be on November 9th at 1:30 p.m. with Isabel Fulcher, the Vice President of Data Science at Delphina, and a former HDSI postdoctoral fellow. Registration is available, on our website, datascience.harvard.edu, and through our weekly newsletter. We hope to see everybody there. And again, thanks to everybody. Slawek, thank you so much, and we'll see you next time.
Thank you, Lawrence, and thank you, everyone. It was a pleasure.